Evidence-based nursing practice is the wave of the future of nursing. Everywhere you look nowadays, there are articles posted on how to improve nursing care through evidence-based practice. As a nurse educator, you are at the front line of distributing a new change to practice or a new policy or procedure to staff. Depending on the complexity of the change to be implemented, this will determine how the information will be disseminated to the staff. For example, is this just a simple policy change that a simple read and sign would be sufficient? An example of this was the implementation of the scrub caps that we got on our unit. So the scrub caps are the orange caps that go on all IV tubing ports and all IV saline locks. And research has shown that the use of these will decrease the risk of infection. Another example of an evidence-based change is the new sepsis protocol that was initiated at Strong Memorial Hospital. When the new initiative was implemented, mandatory education went out to the entire staff that included modules that had to be completed. So it was part of our mandatory pediatric education, which is actually a yearly requirement that we have to do to make sure that we stay current on the education. And along with the module, I actually had a station at my yearly pediatric skills day, which is mandatory for all nurses to attend. So nurses were able to get the education not only on the online module, but also in a classroom type setting where they could ask questions if they had them from the instructor. At Strong Memorial Hospital, evidence-based practice is incorporated into your yearly evaluation. What I mean by this is we have an evidence-based practice portion of our yearly evaluation, and to get a meets expectations or exceeds expectations, you must complete a evidence review worksheet on a peer review article that you've located. After you have the article, you will fill out the review worksheet, and then you actually need to present the findings of your article to the staff. So the journal club peer discussion occurs during a nursing huddle or anytime a member of nursing leadership is available. So the article review is presented to any of the staff members that day, and time is allocated at the end of it to ask any questions. There is also a binder where the evidence review worksheets are located, so you are able to go and look at them if you weren't able to be present for a presentation. In the article From Caterpillars to Butterflies, it discusses that step 1 is to detect any barriers regarding the implementation of evidence-based practice. I feel as a nurse educator, it's your role to break down any barriers regarding the implementation of evidence-based practice. I feel on my own unit that there can be some negativity for the implementation of a new technique or a new practice. Sometimes it makes a technique or practice a little bit longer, so people can be resistant. Unfortunately, there's that age-old saying, well, this is how we've always done it. While that can be true, just because that's the way that's always been done doesn't mean that that's the most efficient, effective, and evidence-based way to do it. I also liked from Caterpillars to Butterflies, they discuss how you need to form a partnership with your leadership and also engage your leadership in evidence-based practice. Thankfully, I have the support of my leadership and involve them in planning my yearly pediatric skills day. They help me pick out which date is most convenient for the entire staff and what topics they would like to see taught to the staff. They also are wonderful about reinforcing to the staff that it is mandatory. So it's not something that you can decide you want to come to or not to. It is mandatory for all the nursing staff to attend, which is great because then I get a really good turnout of the nursing staff. And the information that's presented there is not only information from my nursing staff, but nursing staff from Strong Memorial Hospital as well. Along with making sure it's mandatory, the day of the skills day, the scheduler will actually schedule the nurses that are on that day in a way that everyone can kind of cycle through. It usually takes about 3 hours, so sometimes people kind of have to cut things a little short to get back. but it does ensure that the entire nursing staff is able to rotate through and at least get most of the skills day done, if not all of it. Without this support, trying to make skills day happen would just be a lot harder. Trying to ensure that people attend would be a lot harder. So this support is wonderful, and I think that that is a very important thing when you're trying to instill evidence-based practice on a unit. Is you first have to get the support of your nursing management to help to ensure that those changes can take place, and then from there you have to work on the staff and getting them to want to make the changes.